Hello, everyone. We'll just wait another minute or so, get a few more people in, and then we will get started. All right, I see our numbers climbing, so let's get started. Hello, everyone. Welcome to our industry showcase today, using financial ERP as the backbone for growth, innovation, and AI investment on February 10th, 2026. My name is Madison Lohman, and I will be hosting today. I would like to begin by acknowledging the Indigenous peoples of all the lands that we're on today. While we meet today on a virtual platform, I would like to take a moment to acknowledge the importance of the lands which we each call home. We gratefully acknowledge that we are on the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples, and is now home to many diverse First Nations, Inuit, and Métis people. We also acknowledge that Toronto is covered by Treaty 13, signed with the Mississaugas of the Credit, and the Williams Treaties, signed with multiple Mississaugas and Chippewa bands. Please take a moment to share in the chat the territory you're joining from today. And just on a quick technical note, please use the chat or Q&A if you're having any technical difficulties, and I'll be happy to help you out. We will have some time for Q&A. Our Q&A questions will be sent to Antu and Sandra, and they will be reaching out after, but please put your questions in the chat or Q&A section at any time during the presentation. And today's industry showcase is brought to you by Sage. Thank you very much for sponsoring the session and bringing together this thoughtful discussion. And it is my pleasure to introduce our presenters today. We have Antu Hossain, who is a public health trained leader with experience across government, healthcare delivery, and community-based organizations. As a bridge builder, she focuses on how data is governed and connected to support accountability, scalability, and proactive planning within public, private, and nonprofit systems. At Sage Intacct, Antu is a subject matter expert advising healthcare and program service delivery organizations on how to collaborate with operational and financial data for visibility and decision making using interoperable AI-ready systems. She holds a Master of Public Health, is recognized as a Canadian woman in global health, and a national hackathon winner for startups in digital health innovation. And we are also joined today by Sandra Perkins, who is a senior solutions consultant at Sage Intacct. She has 20 plus years experience in the tech industry in North America, specializing in finance solutions and values proposition in supporting numerous financial initiatives. She has extensive experience with small startups through to large multinationals across multiple industries and sectors. So thank you both for coming today, and I will now pass the mic over to Antu to get started, and I'll get the screen up.
Thanks so much, Madison. And thank you all for joining us today from your respective places across Canada. And so, as Madison mentioned, my name's Antu, and my collaborator here, Sandra. We're excited on behalf of Sage to kind of join you here. And really, today's conversation is an invitation to learn more about what financial ERP really is, but also what it can do, not just for a finance team, but for an overall organization. Next slide, please. Awesome. So we've got a packed agenda today for you. We do plan on grounding, the realities of digital health and what the trends are today in Canada. Many of which is very familiar to many of you on the line. Then kind of diving into what is financial ERP, breaking it out into some of the features and functionalities, as well as the backbone of trust and compliance that it offers. Then we're going to get a little bit spicier and show you a bit of a live demo through Sandra. And we're going to kind of really dive into what does it take for you folks to consider digital transformation, respectively, across your organizations, whether public, private, nonprofit, with confidence. And ultimately, we will speak to AI readiness and how can you set yourself up in this day and age to be ready to use AI and AI data insights to take your organization to the next level. And if we have time, which I hope we will, we'll dive into some Q&A. Awesome. Next slide. So for today, I wanted to make sure that we ground ourselves in what is happening in Canada, right? So a lot of these words on the screen, I'm sure, are familiar to you all. But first and foremost, when we talk about digital health trends in Canada, it's important to understand that these priorities that we see on the screen are not optional anymore. They are, in fact, the precedent of what we need to be working towards, and frankly, what we already should have been towards, right? So a lot of what we can see in terms of the first trend here is interoperable systems. I'm sure this is not new to anyone, but what interoperability, I think in the exciting times that we are at today within digital health, is that we finally see, federal digital health legislation underway. We have the Pan Canadian Health Data Strategy, and we do now have funding tied to certainly some policy outcomes. And really, what the goal of interoperable systems would be is to be able to have visibility from finances, operations, and program data across systems. And when we talk about Canada and Canada's Medicare system, we talk about portability, right? We talk about the ability to be able to move from any location that you have without having any issues as a Canadian resident in accessing care. But we do find that when we don't have interoperable systems, right, that's where that portability, that true virtue of Canadian healthcare no longer stands true. So something that I think many people in the room have been actively working towards, and it's exciting to see some policy changes leading us to have systems that align and sync up across organizations. Lack of real-time data, this is something that I think many folks are constantly agonizing over, right? Whether it's Canadian, healthcare providers, digital health startups. I realize there's quite a few different people in the room today. So from wherever you may be, the lack of real-time data is what is now the expectation to make evidence-based decision making to help you and your organization, whether it's a program, whether it's clinical care, to move forward and accelerate. However, of course, it still seems to be a struggle. um, and then, of course, the third trend here on the screen is quality care. So, quality care in Canada is increasingly defined by outcomes, equity, and sustainability, right? But quality initiatives don't exist in isolation, right? We rely on quality care being driven by funding models, workforce capacity, and long term viability. And a lot of this has to do with us now being publicly accountable for the outcomes that are delivered, whether across a clinical setting, a programmatic setting, or in an exciting digital health new innovation space. Everything, as you can start seeing, is a trickle effect, right? And so the overall goal in any digital health space is, of course, to ensure that quality care remains equitable and of utmost priority. And I think we do realize that the last facet here of workforce planning, right? We are in a difficult time where every organization across the board is asking each other how can they get leaner and do more with less people, less resourcing. So especially when it comes to Canada's healthcare workforce, right? Seeing the trends after COVID, and of course ongoing realities of what COVID has kind of impacted our system, we see that workforce planning is now looking at people figuring out staffing costs, funding constraints, and how your program can still be viable, right, without cutting funding completely from your donors or your investors. So it's making it very difficult with less people to make decisions around how to use those lesser people to do that effective work sustainably. Next slide. So, now that I've laid the background for how a lot of us here in this room are tied together. All of those trends are things that I think all of us can speak to, no matter which facet we come from. I do want us to talk about why ERP. Like, why are me and Sandra here talking about financial ERP, and what really is it? So, just to kind of summarize, whether it's interoperability, it's real-time data, or quality care and workforce planning, everything kind of aligns when you are not able to make decisions because they're all scattered. And this cuts across everyone from clinicians to operators, technologists to finance leaders and executive leadership, right? So for us, we're today going to be talking about financial ERP as the infrastructure to set you up for success. And really, it's because that infrastructure is what is going to connect your decisions to the reality of whether it's your program, whether it's your clinical outcome, whatever it may be. And I do want to maybe, speak about how a lot of us don't exactly understand that financial ERP isn't just for finance people. Financial ERP is often misunderstood. It's really thought about just accounting or compliance or back office systems. But in practice, and this is the message that I invite you all to kind of take in with me and Sandra through the rest of this webinar, but also, invite you to think about it differently. Like, what is financial ERP in an organization at large, and how can it connect strategy, resources, and outcomes? Next slide. So, I mean, how can we not laugh? Like, how often do you see Mr. Simpson here being a reality of a lot of the conversations you have in your day to day? Whether again you're an operator, you're a leader, you're on a programmatic side, the numbers just simply don't match. So, case in point, your team pulls a report, then immediately opens Excel to verify it. Two people are looking at the same data, but they're getting different answers. Nobody can click into the number, nobody can figure out what that number means. And then, now you're having several meetings to justify why things aren't aligning. And then ultimately, what starts happening is people don't start trusting not just the data, but the people behind the data. And that's a big no no, right? We never want to kind of risk corroding trust in an organization. So when I think about financial ERP, I don't know about you, Sandra, but I think it's really that hunt for a single source of truth.
Yeah, you're absolutely right. And so many implementations at the outset, we have always run into the issue of two disparate reports from two different departments. They're running, the numbers don't correlate. So, of course, everybody's running around with their hair on fire trying to figure out why exactly we have skewed results. And it's something that a lot of times it turns out to be something as simple as one of the reports was outdated, and they're reconciling to numbers that aren't correct on the one spreadsheet. So really, ERP is getting to that single source of truth for the company, and not just for the individual needs that whoever is building their own little Excel reports in silo. We want to get away from that.
Yeah. I think as Sandra said it so well, it's not about the individual, but it's about the overall organization, whether it's the overall business, the overall nonprofit, the overall clinical care delivery, right? That one spreadsheet being broken, right, has ripple effects where Sandra, just it's such a humorous image, just to imagine someone walking around with their head, yeah, quite literally cut off like a chicken, and just wondering, what are we going to do? Why aren't things reconciling, right? So this is an ongoing trend that we see. So with that, next slide, please. So I think just to bring it all home, right? So why has financial ERP, as kind of where me and Sandra are speaking to, it's not just a day-to-day task, it's not just about reconciling. It is now a leadership decision that affects the organization at large and no longer just a finance team. So over to you, Sandra, like in terms of, decision readiness, what do we think about when we think about financial ERP?
Well, when we're talking about financial ERP, decision ready data analytics, and AI as well, the big thing is decision making drivers. You want to be able to trust
Mhm.
the the numbers that you're looking at. So your data, trust, and execution, it all comes together. or it can fall apart. And ERP definitely solves all of that. And then we talk about analytics, having clean, connected, decision-ready data to help you drive those really strong financial, operational, and program analytics to ensure that the numbers are correct. And then, of course, AI, we want it to really help drive and strategize what you're doing in your organization. Next, modern digital strategy and modernization, right? Digital health organizations, they're adding tools constantly. And without that strong financial backbone, those tools don't form a system, they're forming silos. So, we want everything to be holistically together to give us a very seamless, smooth digital operation and strategy, right? And that's where we lead into, having that very strong connected ecosystem of tools to, give us really cross-sectional analysis of data to move the organization strategically, into the future.
Yeah, and I really love that. We're gonna dive into some of those cross sections of data, right? We're gonna see that in Sandra's demo upcoming. So I know we're building up the suspense here, but for us, what we're emphasizing here is why would you have disparate number of tools that are all giving you multiple messages and you're not connecting them, right? Now you have a backbone of an organization that isn't very strong or frankly secure in what you're hearing from the data. And so the data is only as good as what you get to input, but the systems that operate and sync those data pieces together are only as good as a strong backbone of a foundational system, such as an ERP, which brings, whether it's an EMR, whether it's a CRM, so donor relationship management tools, aligned and all together. So I am going to kind of just summarize here where it's not just about the tools I think that people on this call are thinking about, but it's also, how can I convince my leadership in my organization that we need to make advancements that are for the security of and sustainability of our organization, right? So what does security controls look like in ERP systems? And how does it bolster compliance? How does it strengthen governance, right? How does it make you well equipped for your audits, and just make you feel like, hey, I know my data all makes sense. I know that the decisions that we're making, that we're confident and we can back. And I think that is where, especially with Sage Intacct, having built-in security controls, having our data residency, right, within Canada, having our cloud native solution have backup centers in Canada itself, kind of all earn that confidence of where, if you were to move to a backbone like an ERP and you were syncing all your multiple tools through this medium, that rest assured that it is safe, and it is something that you can access. So many reasons here, but really the main sum being it is not just a decision for one team to make, but it affects the overall organization. And these are various reasons if you ever come across your manager or your executives as to why you should be looking at ERP, these are some of the reasons. So actually, we're kind of tired of hearing ourselves. So we're gonna turn it over as a poll, and see what folks are resonating with. So, what slows your organization down most today? There should be a Slido link that Madison will kindly pop into the chat.
So it turns out that I can't share the Slido while I'm sharing
Oh,
screens. So I'm going to stop sharing screens and then
okay.
you should see a Slido, but I just want to
That's
let
perfect.
you guys know that.
Yeah, that'd be
Okay.
awesome.
All right. So you guys should see on the screen. Let me see. Okay. And I'm hoping that everyone can see this on their screens. You should see what slows your organization down most today.
I don't see it, but
Oh, I have one typing.
oh, so others are seeing it. No, Deborah says
Yeah,
no, no,
no.
she does not see it. No.
I am getting results.
Oh, okay.
Hold on. Let me see. Interesting. Okay. Okay, so I guess I'll read them out to you guys then.
Yeah. Yep. Okay. Yeah. A few of us can't see it, but it seems like you
That's
can interact with the Slido. Madison, are we able to put the Slido link in the chat? Is that?
That is a great question as well. Let me get that on the internet. Okay, let me share the join link. Okay, sorry everyone.
Oh no.
Slido is new to me. So, okay, you can join the link in the chat there. And then
Amazing. Yes.
let me share the Slido screen. Maybe this will work better too. And then you guys can see the results and talk about them as they come in. Okay. Here you go. There. Forgive all my tabs, but this is
No,
what we're
it's great.
seeing.
Yeah. Yeah. I see real-time action. People.
Okay.
So in terms of the question here, so what's slowing down your organization most today? Number one, disconnected systems. Feel like that's really running the race here. Um, and then shortly behind that, kind of tied, are lack of real-time visibility and all of the above. Okay. So we're really feeling the crunch across these challenges. Okay. So disconnected systems seems to be the number one winner here, followed by all of the above. And unclear accountability across teams seems to be the least of the slowing down in an organization, which is great because it just means that you all trust your team, but you don't necessarily feel that the systems are keeping up with your team and how best your team could use the data that is coming out of these disconnected systems. So there's a lack of real-time visibility, manual or spreadsheet based reporting. Of course, listen, I think all of us have a safety net of wanting Excel to be the safety net, but it breaks. And then there's like 50 different versions, and it's quite the mayhem there. But I think this was extremely helpful to kind of iterate that we're all pretty aligned on this call that disconnected systems, in addition to real time visibility, manual work, right? All start feeding into each other. But when you have disconnected systems, you ultimately will have a lot of the symptoms that we see here. So thank you so much for participating, and appreciate the patience with our technology here. Awesome. So moving on then to where and how we have seen automation, right? Kind of play into a lot of the use cases that Sandra and I come across. So I specifically advise healthcare organizations, I advise nonprofits, both for profit, nonprofit, and in terms of what would it take for them to consider a financial ERP. And often when we talk about automation, there's a little bit of both excitement, but also, hey, does this mean my job is going to be completely removed? you know, or the job of, my zero point 0.5 FTE person that I have. How can I salvage their job while also making them do a bit more value based work, right? Not necessarily kind of getting stuck in just manual efforts, right? So a lot of the times, whether it's 10 extra clicks to get a screen to connect with, your other screen, as an example, it's these manual efforts that starts creating bottlenecks, right? And starts making someone's day to day, in the 8 hours they may have, at least 2 hours just spent figuring out manual processes. So when we talk about automation, we realize that around 79% of healthcare finance leaders want it, right? And then 86% are calling for better tools that kind of help with outlier detection, as an example, alerting you to looking at your data in a much more scrutinized way so that you can make decisions faster. So we are seeing both the desire kind of keep up with where the tools are moving towards today, which is automation. However, one thing I always kind of bear in mind is automation isn't going to remove the person. Automation will actually help them have a lighter day so they can focus on more value-based or strategic work. And ultimately, what does that mean? That means that staff morale is high. People don't feel like they're just monotonously doing something or that they're taking on so much extra work due to manual effort, right? It boosts staff morale and it also reduces turnover. At the end of the day, a system and tools, they should all kind of help you do your job better, but not completely erase you from the picture. And that's kind of where we emphasize using tools like ours. I actually had an example to share. So, in one of the organizations, uh, approval invoices relied heavily on email chains and memory. Don't you love it when things rely on memory and multiple people's memory? And so, what ended up happening is that invoices were late, right? Because people just didn't kind of care or they weren't able to keep track, and they were late because they had no visibility, right? So a bit of a perfect storm. Memory, not being able to keep track, and just no visibility whatsoever. And program teams, what ends up happening emotionally in the team, program teams are now frustrated. Finance is now seen as the bottleneck, right? And then the trust begins to erode. So after we kind of implemented automation specifically around invoice processing in this use case, right? It didn't just speed things up, but it made accountability visible without creating friction across the teams. So what we can now see is improved cross-functional impact, improved working relationships across teams, but also you just save a few extra hours in your day and you can use that whether to go home or to kind of focus on more strategic based work. So I'll move on to the next slide there. Thank you. And then a bit of also where, we see people questioning whether they can trust their data, right? When we talk about the number one reason a lot of you folks spoke up is fragmented systems. Fragmented systems equals delays in decisions, right? 90% of healthcare finance leaders struggle with the data accuracy. We spoke about how just reconciling, two different spreadsheets can take hours and several meetings, right? So people are just frustrated and then they don't feel excited or empowered to make proactive decisions in their organization. And really a lot of the time what we see is this 90% statistic. It doesn't reflect bad finance teams or bad operational teams. This is not a blame game, but it shows that systems are not giving people the confidence that they'd like. Next slide. So just to kind of bring it all together and bring it all home, I think there's some three major uh, outputs that stand out when we see planning and reporting breakdown. We see silos where data is living in different places, right? We see spreadsheets and the sea of spreadsheets where manual work becomes the connector, right? So you're manually uploading this spreadsheet and then you're downloading this one. So manual work becomes the main thread between your day-to-day job. And then ultimately, what does that affect in terms of outcome? Late answers, right? You can't get back to your team on time. That team can't make this decision, which affects this decision. And the next thing you know, the data is stale anyways. It's old, it's outdated. Why would you bother using it anyways? Right? So then we start the cycle all over again. I feel like, though I can't see many of you, I feel like you're all nodding in agreement. So I'm just going to take that silence as full-hearted consensus that you all have probably felt this way. So now I get to kind of share how our system looks when it comes to helping you move past this. So over to Sandra to get to kind of show us a demo.
Okay, thanks, Antu. And I'm going to go ahead and share my screen.
Of course.
And let me know when you can see it. Everybody see it yet?
Not yet.
No,
Sandra.
try again, Sandra. I just had to allow multiple people to share.
Oh, okay.
Yep.
Everybody see okay?
Coming around the mountain, Sandra.
Okay.
There
All
we go.
good?
Yes, yes, we can see it.
Okay, great. Okay, so just a highlight of one of our great reporting tools. What you're looking at here is what we call our dashboards. And really, these dashboards, they give you the information, the metrics, the reports, everything that's relevant to you on a day-to-day basis, right? And really, the value of all of this is as a user, you're always making sure you're keeping your eyes on things that are going to make you most productive on a day-to-day basis, right? I'm currently, if you look here, I'm logged in or looking at a controller's dashboard, right? But again, I've got a couple of our demonstration environments open. This one here is our healthcare. And really, not just a dashboard built for a controller, but you can build out these dashboards to regarding your need and your use, right? If I go ahead and select another dashboard, and actually I go over here, I've got some favorited marked. Let's say I'm a department manager. What's important to me as a department manager? How am I tracking from an admin perspective, right? My viewing of my actual versus budgets. I can have some very key KPIs that perhaps are most interesting to me on a day-to-day basis. And all of these have drill through capabilities. Wherever you see this blue highlighted as well, drill through capabilities to really give you that insight into action to get back to the source transaction. As well, let's say you're more interested in just from a metrics perspective. How are we tracking? This one here is, we're looking at the long-term care facilities. So, our revenues per bed occupied, units available, our variance analysis, all of this at your fingertips to be able to look at and disseminate and make strategic views and financial decisions based on future availability, right? As well as maybe we want to look at it from a patient care perspective, right? Again, giving us that great view here, we could actually look at it graphically, how our profitability is trending as well. And maybe we're looking at our behavioral care dashboard. We can build one of these up. Again, you start to see how strong and powerful the dashboard reporting can be within Sage Intacct. As well, in multi-entity environments, they all reside within the same instance of Intacct as well. So, this is looking at it from, more healthcare slant, as well as if we even just look at it more holistically from just a purely nonprofit perspective. So again, perhaps you want to look at a dashboard on how your grants are tracking. How are you, your revenues program year by year? How you're tracking against your operating budget versus your actuals, showing you your variances. Again, where there is variances, to be able to drill right back in to see this source documentation, to see where exactly, where the shortfalls are. Why is there, disparity between your actuals versus budget? As well, from a grant manager, maybe you want to look at it from a program perspective, how we're tracking. Again, all of these dashboards, very easy to use, very easy to set up. And then you'll notice over to the right-hand side here as well, within Sage Intacct, we have a concept called dimensional accounting. So what it allows me to do is to be able to really slice and dice the data. So maybe I want to look at this dashboard just from maybe an operations perspective, and I can even narrow that down further. If I wanted to narrow it down by a fund, I could do that, as well as with a grant as well. However you want to view your data, and then it's as simple as selecting apply. And what's going on now is the dashboard is going and it's refreshing in real time, and it's bringing me back that information on a real-time basis. So now I'm looking at this dashboard strictly based on the dimensions that I have selected up here. So a very, very powerful, very powerful tool. The key benefits, I guess, the key takeaways before I pass it back to Antu is really, tracking and reporting accurately to getting, the most out of what you're looking for. You're capturing your costs accurately. You're easing compliance and audits. You're saving time and improving accuracy. And really, with these dashboards, when you're pulling in your actuals and comparing your budgeting and reporting, it really, because so much of this is automated now, single source of truth, and you can really have that deep trust in your budgeting and your planning, analysis, forecast, and reporting. And I'd like to stress as well that the budgeting and planning functionality is native within Sage Intacct financials as well. So again, just to give you a sneak peek of the ease of reporting that we do have from a dashboard perspective. And like I say, numerous different ways you can build these to really give you instant insight as to, how exactly you're tracking by whatever KPIs are most important for you as an organization to really strategically place you in a great position for future growth and into the future.
Sandra, before you leave this dashboard here, I'm looking at fundraising efficiency. I'm seeing average gift amount, average donor. Is a lot of this connected with, let's say, a donor management tool? Let's say if you wanted to, as a nonprofit, connect your donor tracking with
Yes,
Sage Intacct?
absolutely. So with Sage Intacct, with our great API connectors, we have a number of marketplace partners that we do connect with. So yes, you can bring the information in. Depending on the application that you're using or the your other solution providers, it can be a bi-directional feed as well. So to short answer to your question, and two is yes, absolutely, you can have feeds in from other systems with our open APIs. Yeah.
Amazing. So I think where I got excited when I first looked at Sage Intacct, coming from both nonprofits, but then also private sector in healthcare delivery, the different KPIs at the end of the day can feel slightly different, like grant tracking versus clinical like occupancy rate, for example. However, I was amazed that at Sage Intacct, you were able to kind of speak to all of those KPIs that are important to very specific industries and have them be built out in a pretty user intuitive way. So everything that Sandra's showing, somebody could just build this role-based dashboard, right, Sandra? You don't need to be an IT coder. You don't need to know SQL to build a
Exactly.
dashboard.
Yeah, just quickly, we have a tagline that Sage Intacct was designed by accountants for accountants. So literally all of our reporting is very easy and intuitive to walk through and build. So just quickly, I won't build the whole thing, but let's say we wanted to add a chart, which is one of the ones that you saw on the dashboard here. It's as simple as selecting the component type you want, chart, and it walks you through. Literally, it guides you with these little asterisks. It tells you that it is an acquired field. What is the component type that I'm building? And of course, you give it the title. What type of a chart do you want? Line, column, stack, column, pie, donut, wrap, so on and so forth. Your legend, if you want to build one in. And then it's as simple as that. Once I've built in all my parameters, it's as simple as saving it. And then once it's saved, it is immediately placed on my dashboard as well. So again, easy to use. Maybe I didn't want this report anymore. I can delete them. with my scorecards. I can move them around. It's very interactive, but I'd like to stress that yes, very easy and intuitive to build these dashboards to specifically how you want. And of course, security is pervasive throughout the system. So you can share with other individuals in the organization, or you can, of course, have it just for yourself as well. And again, even if you do share it with individuals, again, with the security, if they do not have access to specific views of the data, of course, they will not see that. So
And
with
I think
that,
that's sorry. No, go on, Sandra.
no, I was just going to pass it back to you to carry on.
Yeah, no, I appreciate that. I think yours is the most spiciest part of our presentation. So, but at the same time, I think what Sandra is showing is at the end of the day, we want an organization to feel empowered when it comes to using an ERP. They shouldn't feel like subject to added IT cost, added customization costs of any of that nature. Everything that Sandra has shown as a role-based dashboard, whether you're a program manager, whether you're a finance manager, whatever it may be, right? Those role-based dashboards are to allow people to get get nitty-gritty with their data, make decisions fast, and not really rely on external parties to help you do that. So the intuitiveness of building a role-based dashboard, but also what Sandra emphasized is you can simply share a snippet of your dashboard or a report that you've built, and you can email it out to your board, to your executive team, to whoever needs to see it. And you can automate that too. So every Monday, send a report that looks like the way the board wants the report to look, by the way, because I know a lot of folks also spend time retrofitting, managing how data should look like and be presented, right, to different audiences. That is now with a few clicks and an automated email. So they'll get it every Monday and they'll see exactly what they need to see. Right. So that's where the controls are really important to keep in mind, right? We want people who need to see the data to see it and not anything more from that. And that is a good way where you can have preferential access to things like dashboards, budgets, and everything that we're showing today. So thanks, Sandra, for that. And then Madison, if I could get you to. So this is kind of where I hope from the user intuitiveness of what you've seen in our demo here, right? How can you feel more confident charging the way for digital transformation in your organization, right? Number one, let's be honest, right? If you're on a legacy system, at this point, it's slow. It's not allowing you to progress in an agile way that connects with the realities and demands of the care that you're delivering, the program you're delivering. So I know a lot of people can just feel a bit more fearful about change management, that they just don't want to change or they don't know how to start change. And that's where, we want to earn the confidence when it comes to the many different organizations that have kind of trusted us, whether it's for profits, nonprofits, around how to build a suite of tools that all integrate and connect. And financial ERP is kind of the backbone of all of that. I'll move on to the next slide then as well. Um, I do realize there's probably a smattering of people on this audience here today. So just to kind of iterate, whether you're somebody in a leadership role, whether you're somebody delivering services and goods in operations, as an example, or whether you are in procurement, creating your own startup, there are many reasons that this would matter to you, right? So for leaders, how can you get ahead of risk, strengthen governance, and get yourself set up for success for the next round of funding, for the next, funding source that may come by? How can you be sustainable? The only way to do that is to have decision making and insights that help you get there. Service delivery, right? We talked about it. Health workforce planning as an example. How can you do more with less? That is just the name of the game today in this landscape. So how can you slice and dice your data in the way that Sandra showed for you to understand which departments are needing support in X area over Y, right? How do you get granular? And I think for service delivery folks, you need that information at your fingertips. And then of course, when it comes to folks like in startups or in vendor procurement, how can you create a runway for you to feel that the foundation of the data systems you have are interoperable, that you feel confident behind those systems, and that helps you procure more tools, as an example, or scale your startup. Next slide. I'm going to pause here because I'm going to turn it back to you folks. Madison, if you could kindly put the Slido question here.
Okay, let me get my other screen ready. Hold on. Okay, maybe I'll make it prettier this time and put it in present mode. Okay, here we go.
So the question here is, what gives you the most pause about AI today? And I believe the link is still in the chat. There, wow, yeah.
Perfect.
Perfect. People are responding. Okay, so yeah, privacy, security, and compliance, reliability of data. Amazing. Okay, um, I'll just kind of take a snapshot of what we're seeing here now. So what's giving most folks a healthy amount of, I would say, discernment around AI is the privacy, security, and compliance, followed by how do you explain AI? How do you explain what AI is doing for your organization? So the explainability and governance piece, and then lastly, the data quality and reliability. So these are all things we hear pretty frequently, right? And so one thing that we're gonna dive a little bit more into in the remaining time we have here is how can you feel AI ready as an organization, and where can you kind of go from here? Madison, if you don't mind, like switching over to a few more slides later. Next slide. So here is where, for example, when we talk about activating AI, I want to be very clear that we're not in the game of replacing people. I think you heard me speak about that around automation, but it's about helping your organization and your individual selves feel empowered with the insights that you could gather from AI itself. Um, so whether everything we talked about today, interoperability, real-time data, workforce planning, those are all the inputs, right? But AI is the output, and the foundation is there for your team to build that. If your data is structured, if your data is syncing across different tools, and if your data is telling a single source of truth, adding in AI at that moment takes that single source of truth and turns it into insights that you can actually turn into decisions that you can make. I don't believe that when we see the 83% of healthcare finance leaders believe here that AI could benefit their teams, yet on the other side, only 10% are using AI powered tools daily. I don't believe it's an issue about belief. The gap isn't about belief, it's about readiness. So, how can, with governed data, connected systems, and clear accountability, how can you set yourself up to be AI ready and to use AI in a way that you trust it? And that's where ERP would definitely help you kind of get there. We are going to move on to the next slide here as well. So I'll let Sandra kind of speak to all the cool things we're doing on AI.
Yeah. Sorry. Yes. This slide really is a great depictor showing that we are an AI pioneer, right? We've invested developing accounting specific AI solutions for over 9 years, actually, from conversational AI and customer support apps through anomaly detection of GL, AP automation, and now Sage Copilot automating and close. We're really delivering productivity and insights for customers globally and saving hundreds up to thousands of hours annually. And our team of specialists, they use their expertise in machine learning, generative AI, agentic AI, to design trusted AI solutions which operate at scale, rapidly, and securely. And really, the number on the screens here speak to our success. And really, these numbers, they're growing every day. Next slide, please.
Sandra, if you don't mind, I think we'll hop to the video.
Okay, sure.
Yeah. So I think that's in the next slide over. And one more. Perfect. We'll kind of show you folks where our AI is at. There should be audio coming in, Madison.
I think I can hear it.
Okay.
Can you hear it?
No, I don't know if you're able
Oh.
to enable your audio for us to hear.
I don't know. Let's see. That's so odd. I don't think that I know how to do that.
That's okay. We'll just play the video. It's all good.
Okay, perfect.
Bilal has a suggestion. That's okay. So Sandra, what are we seeing here on this video? I think we'll have to kind of speak to the video. Oh, I think you're on mute.
Yeah, really just to encapsulate what the video is depicting is our what we call our AI agents. And really they're systems that can think, decide, act on your behalf, of course, within rules and conditions that you define, right? Those are the core technical traits of an agentic system. It reasons, senses context, executes multiple steps, and takes real action. And what you're seeing here is some of the offerings that we do have. We have AP, pardon me, AP automation. So that really streamlines your vendor invoicing. It will read the invoices, create draft bills, which really in effect reduces manual entry and improves accuracy. We have an offerings of intelligent time. So use AI to suggest timesheet entries based on calendar, email, or app activity. Again, making time tracking faster and more effective. And then our latest offerings, close automation, again, streamlining, accelerating that month-end close, tracking tasks, flagging issues, outlier detection, flagging unusual journal entries in real times, helping approvers spot potential errors before it actually hits the GL. And then what we saw here is our finance intelligent agent. And really what this is doing is it's helping finance teams get answers, make decisions faster instead of digging through reports, assembling spreadsheets. Users can go and simply just ask a question to get the answer that we need. For example, what bills should I pay by the end of the month due to my cash flow restrictions? what the agent will do is analyze the payables, look at cash on hand, payment terms, discounts, other relevant factors, and it then recommends the optimal set of bills to pay, and it explains why. So again, giving your finance teams, confidence they're making, the right decisions for the business. So, ultimately the goal of all of our AI agentic solutions is removing that manual effort that slows teams down and replaces it with instant clarity, right? And you're getting trusted answers in seconds. And then, we always say it frees up their time to focus more on managing the business and helping with strategic initiatives in the business rather than just managing data and tumbling data.
Sorry, Madison, could you press next slide, please? Just to what Sandra was speaking about. Sandra, did you want to summarize what we're seeing here? I know you just did, but.
Yeah, so this is interactive. So where you would be asking Copilot a question to that example that I just shared, I think you can see one of them is similar to it, show vendor bills with discounts. So we want to ensure from, payables perspective, you're capitalizing on as many discounts as possible. So it will come back, it will do the analysis for you and present you which invoices to be paid. So that's just one example. There's numerous other ways. I'm sure that you all can think of wonderful ways that you can be interacting with our finance intelligent agent.
Awesome. Thank you so much for that, and appreciate everybody kind of hearing the video in imagination. We will be sure to send the link around after. If we're just gonna maybe wrap up on our last slide here, Madison. So to many of you, thank you so much for joining us today. I hope that we've invited you to open your minds to the concept of financial ERP and the fact that it is not something that is only for finance teams. The ripple effects that it can have for decision making, for clinical teams, for programmatic teams, for operations and decision makers at large, right, is kind of key for you to be able to scale when it comes to innovation, especially in the digital health innovation space, right? We also kind of touched on planning and reporting, showing you the ability to get granular, to slice and dice your data, to find all sorts of insights that you may not have found before. And of course, speaking even more so to AI and what does AI readiness look like for you and your organization? And then, of course, preparing yourself to perhaps even have these conversations amongst your team as to whether you're in a place to consider a financial ERP transformation in your organization. So the next slide here. We hope that you've enjoyed connecting with us through this session, but we're available here. Feel free to scan this QR code. These are our emails here. We do appreciate that there are some questions in the chat, and we will make sure to follow up after this webinar. So thank you so much for your time, everybody.
Awesome. And I want to say thank you, Antu, and thank you, Sandra. I have a last couple of slides here for Digital Health Canada. I will stop sharing. Oh, hold on. 1 second. Perfect. Okay. Got it. So if we could, you'll see on the screen in a second, you will see the satisfaction poll. If you guys could just take a second or two to answer that, that would be great. It does help us to know what you guys like and don't like about our industry showcases and our webinars. We want to hear from you guys. So thank you for taking a couple of seconds to do that. I'll leave it open for another couple of seconds to get last minute answers. We also have on the screen here the industry showcase specific survey that you can scan with the QR code on the screen. It is very quick, only a couple of minutes to take the time to answer the survey. So we would love, if you have any specific comments about this industry showcase, we would love to hear that from you guys. So scan that QR code. The link will also be sent in an email as well. Then if we have any of our members here, you can feel free to join the event discussion thread in the Digital Health Canada Community Hub. So you'll just head over there and you'll see the Industry Showcase webinars section, and you can actually log into our Community Hub through our Digital Health Canada website. So you'll see on the screen here. And our upcoming events, we have Ontario 26 happening Thursday, March 19th. And then, of course, we have eHealth 26 happening in June. So we would love to see you guys there. Early bird registration is available for eHealth. So we would love to see all you guys there in Halifax this year. And I just want to say another big thank you to Antu and Sandra. And thank you to Sage once again for sponsoring this industry showcase. It was a wonderful presentation. Everyone will be receiving the video that only I could hear in my headphones, I think it was. So you'll receive that link through your email as well with the recording of the video. So thank you, everyone. Have a great rest of your day and have a great rest of your week as well.
Thank you, everyone.